agenda, and then I want to talk about something that we're going to do starting this meeting, right? Part of that is going to be called the mission moment, and I'll tell you about that. So I've said welcome, at least I hope so. I hope everybody's summer has been great, and we're looking forward to what is next. I am going to talk a little bit about the council survey, the results on engagement. We'll talk a little bit about that. We'll talk about the helpline, 988. We'll talk about the implementation in Maryland, what that looks like. And then we'll do announcements, closing remarks, and then we'll adjourn. Please don't hesitate. If you have a question or comment, either raise your hand or put it in the chat. If I miss it, somebody, Nikki, Adrian, somebody will get it. And so again, thank you so much for being with us today. So I really want to start this council meeting a little bit different than we've started before. And I want to talk a little bit about what we want to call a mission moment, really, which is an opportunity for us collectively as members to share the ways in which our work, GBRICS work, is helping the community. And maybe you don't have something you may think that is exciting, but it helps us to remember why we're here, why we do what we do, why we think what we do is critical for not just this moment, but for generations to come. And so does anyone have anything to share about how our mission is touching folk, or how you've seen an impact, or maybe a way we need to improve? I'd love to hear from you. And again, if I don't see your hand, just come off mute and say something. And here's the other thing. If you don't have a story today, and you don't have to, I do want you to please send your stories to Adrienne, and we will share them at the next meeting. But things are happening. We are making impact, and there are baby steps that are going on, and we think we'd like to be able to share that with folks. Did I miss anything? Did anybody have a story to share? Okay. All right. Well, one person raised their hand. If only I could see you. Hey, Katie, with the dessert. Okay, Katie, please share.
So not necessarily a heartwarming story, but just that I had the great opportunity to go with some folks from BHA to a regional SAMHSA meeting that was looking at crisis systems, and had featured folks from Arizona and from around Region 3 in the Mid-Atlantic talking about what they were doing to improve crisis systems, and just hearing about other projects and thinking about GBRICS, how forward thinking it is, like the incredible level of collaboration and real concentrated effort and engagement. It just made me very proud to be in Maryland and to be a part of this. So I think that we are absolutely at the cutting edge in our region of how crisis systems are being transformed, and really centering that on the experience of people who are in crisis getting the services they need. So I just wanted to commend everybody for continuing to plug away at this. We're really setting the bar very high.
Kitty, thank you for sharing that, because that's important, and we need to hear that. So that is impactful, right? So we know that we're in alignment, we're on the right path. Anybody else? I don't want to miss anybody, but I don't want to hang here too long. Oh,
Andrea,
Robin, yeah.
Robin raised her hand.
I see it now. Thank you, Robin.
Yeah, hi everybody. I just wanted to say I had an article today, alert that came out from the AFP that said there was a 45% increase in the use of 988 calls since last year. So, across the country, congratulations.
Nice, thank you. Thanks, Robin. Anybody else's hand that I may miss? Thank you, Nikki, for that. Oh, Linda, yes. Anybody else?
Sorry, I'm muted. Just a quick thing. I'm not sure if everybody on this call knows, but the Behavioral Health Coalition has been working very hard since session on how to put together a plan to look at crisis prevention services going into the next legislative session, to really dovetail the crisis agenda with the things that we need in the community system to, reduce the need for crisis as much as possible. So I just wanted folks to be aware that we're working really hard on that. And I also just wanted to throw out an idea for future consideration at one of our meetings. Wherever I wander, I hear a lot of conversation about the kids piece of crisis services, and I think it would be really helpful in a future meeting of this group to specifically look at how we're making sure the unique needs of kids and unique considerations for kids in a crisis system, as well as for older adults, that we have some opportunity for conversation about those two critical issues. Just to think about.
Okay, love it. Thank you so much. It's a good thing it's being recorded because we got lots of good stuff today. I love it. Anybody else? Thank you so much, Linda. Anybody else that I don't want to miss you. If I miss your hand, just say something. Nikki, do you see anybody's hand that I may have missed?
Nope, I just checked.
Okay, good. Okay, perfect. Well, just again, as we move in this space and talk about our work and our impact, things that we can, where we can grow, all of that kind of good stuff. Please be mindful that we're going to talk a little bit about mission moments. I think that that's important. It will help us. It'll keep us on track. So good stuff. So really wanted to talk a little bit about, as many of you know, that in July, the council members were asked to complete a survey. And so I really, again, want to thank everybody. I know that we do more than enough of completing this and completing that, but we appreciate your weighing in. And the reason we did it is because the information is going to be used to plan future council meetings. What do we need to be doing? What should we be doing more of? What should we be doing less of? And how we show up. And so we want to make these meetings as impactful as they possibly can. We want to start one day and finish on the same day. So we want to make sure that we get all the information in. So I really want to thank each of you who provided the feedback. And so a couple of things I just want you to know, based on what you shared. Now I'll go over the results, but based on what you shared and based on the guidance from the council, in future meetings, some of what we're going to be doing is key questions for us to discuss as we talk about our strategic initiatives. And so it'll, again, help inform our work. We'll make sure that we include presentations from partners. Also, again, we'll have brief executive sessions at each meeting, and then we're going to work on in-person meetings at least once annually. I'm hoping that's not me with the feedback, but if it is, just say, Andrew, it's you with the feedback, but I don't think it is. But so again, what you share is important and it's critical. So it helps us just stay on track. So I wanted to bring that up. And I think I've got a few minutes, and Nikki, you tell me if I need to, Nikki or Adrian, let me know if I don't. I wanted to talk a little bit about the survey results. Yes? Okay, good. So, again, we talked a little bit. For those of you who had not had an opportunity to complete it, we get it. We know everybody's slammed. And so we started with the meeting approach. And given the council strategic focus, what types of content should the council actively address? And most people, we talked about whether that was key issues, a number of other things, discussing different stakeholder perspectives. Most folks said that it was relatively, people weighed in and looked like it was neutral. I think what I'm not looking at, and I apologize, I think that I don't have all of my goodies in my survey. And so I want to, if you just give me an opportunity to come back to that, because for whatever reason, when I pull up what I know to be able to report out on, I'm not seeing it. And I don't think it's you, Adrian. I think it's the way whatever converted for me. Does that make sense? Because I'm not getting anything.
Are you clicking on the link?
I am. I'm clicking on the link.
I think you covered it.
Okay, good. I feel like I did, but I didn't want to forget. Okay. So, and again, I want to say thank you to everybody who weighed in, appreciate it. And then as a result, you saw what you saw the what we're going to be doing as a result of your feedback. So good stuff there. Anybody have any thoughts, anything you want to talk about the survey very briefly before I move on to our next piece? Nope. Good. Okay. What a good group. Dessert. All we need now is music. So let's talk a little bit about 988. It was raised a little bit earlier when we talked about, when we talked about our impact and what we need to be doing. And so I think it's going to be important for us, for you, and for us to be mindful that there's a lot of hope and opportunity with 988. It's the new 3-digit phone number for suicide and crisis, Lifeline. And I love that we use the language, not hotline, but lifeline, and even helpline. I think that there's something about messaging that's significant. And so part of what we have committed as GBRICS, we will continue to align our regional call center with 988. But we know we need a well-functioning call center that can deliver consistently. And so we're not confused. I don't want you to think that we are. We're not confused about what we need. This will, as we get to this place, it will increase trust and the support, and support the cultural change that we want to see and that we know is critical. Obviously, and that is for people to call 988 for behavioral health distress rather than 911. And so the type of cultural change is needed before we can really start promoting 988 broadly. And we're going to be working on that. And I'm going to turn it over now to Adrienne to just provide a brief update on how we plan the transition to 988.
Thanks, Andrea. Good evening, everybody. So like Andrea said, we took some time off in summer. The council took time off in the summer because 988 launch was happening. And with that, there was a lot of work happening through the GBRICS partnership. If you may recall, one of the more complicated components of the GBRICS partnership is creating the regional 988 comprehensive call center, which is a lot of that work to stand up that call center is happening now, but a lot of planning work and pre-work happened over the course of the earlier part of 2022. So I'm going to quickly walk you through the timeline and where we are with implementation of this, and then share with you some of the feedback that we've been receiving from the community on 988 already. And also, so we do have some data that we can share. It's Baltimore City specific at this point. That will change in the future, but that's what I'm going to run through quickly, and then we will have a discussion with you all. So what you see on the screen is the anticipated timeline for standing up and implementing the 988 Regional Call Center, which is the call center that's going to support the 4 jurisdictions across the Central Maryland region: Baltimore City, Baltimore County, Carroll County, and Howard County. What we've done so far in 2022 is early in January, BHSB released a competitive RFP to identify a vendor or vendors to operate this regional call center. At the same time, a few months later, we also started to begin the software build out for that care traffic control technology, which, if you may recall, the vendor we work with for that technology is Behavioral Health Link. So that work happened shortly after the RFP was released. In May, we identified the call center operators, and contracts started in June. Very happy to say we've got some of our call center operators with us this evening. One of the things that I think was great, and I may be getting ahead of myself with my slides, but we've got 3 call center operators, and I'll tell you who they are in the next slide, because I know I've got them listed on the next slide, to operate this regional call center. Since we have our call center vendors operators identified, we are now doing a much more deeper dive and more intentional work to build out that care traffic control software. The teams with the call centers at BHSB and Behavioral Health Link are meeting on and BHA actually are meeting on a regular basis to build out that software care traffic control technology, with the anticipated launch of that being in October of this year, so in 2 short months. So I'm very happy and excited to say that we have 3 existing 988 Lifeline vendors who are operating the region's regional call center. Baltimore Crisis Response, Affiliated Asante Group, and Grassroots Crisis Intervention Center. They are all providers that have been operating in the state of Maryland and within this region for a number of years. They came together on a collaborative proposal that won the bid for the regional call center. I personally think this is excellent because we're building off of the strengths and the expertise we already have in our system of care with working with our existing providers. So very excited about this. And just want to give acknowledgement to Jonathan, who's here, and I saw Michael from Sante, and I think Mariana. Just you guys are doing a great job, and celebrate you because this was a big shift, and you're supporting a big system change. So the way this is working is that all three, like I said, all three agencies are existing Lifeline providers or 988 providers, so they know that system and they've been operating within it for a number of years. We're building on their staff expertise by subcontracting. BCRI is the lead entity that subcontracts with Grassroots and Affiliated Asante Group to provide the region with comprehensive call center services. So from a customer's point of view, services will be seamless. The way they are making it work is with technology. They will all be using that same care traffic control software technology that will help them with managing calls as they come in and triage, and then eventually dispatching mobile response teams. And then they're also using the same automated call distribution software, which is what does the routing and figures out who's available, what call center or what call operator is available to pick up the phone at that point in time. So the use of technology is what's allowed them to band together, and it's a really great partnership that they've got. The other thing, a big piece of work that has been happening over the course of last year, but then a lot of work happening this year, is figuring out how regionally we're going to be marketing 988 across the region. So as you may recall, the GBRICS partnership, I identified that we needed to work with a marketing firm to help conduct some market research across the region so we could figure out the best way to be talking about this new resource within the community. We worked with Marketing for Change, which is a communications firm that was also selected through a competitive procurement last year. And they conducted a full, robust market research over the past 9 months to a year across the region, which included doing surveys with people, expert interviews. They got responses from over 750 people to gather information about how we should be talking about these resources and what people like and what they don't like. Some of the information we gained was really helpful, and it was validating. It told us some things that we already knew, but kind of on a larger scale. And some of it has helped us to really hone in on our messaging. So one of the things that we learned through this market research is some of what you see on the screen. Again, some of this is not surprising. First being that there's limited awareness about the transition to 988, and there was even limited awareness that we had these existing helplines within our community and they had been here for like 20 years. So that was something I can tell you from the city's perspective. We knew as we would go out and talk about the city's 24/7 helpline, we already knew that some people would be like, I'd never heard of this. So this was one of those kind of points that was validating for us, just seeing at a larger scale that a lot of people still didn't know about these helplines and didn't know that 988 was coming. The other positive thing, though, that we learned about is once we got people talking about 988 is that the number, and this easy to remember number, left people feeling with a lot of hope, which meant that we need to deliver, but a lot of hope around having a helpline that people could call for themselves or a loved one with if some kind of emergency, emotional emergency came about. So there's a lot of hope and goodwill surrounding this idea of 988 and access to broader system of care. There are high expectations, so we know that we need to deliver on what these promises are, but they know the other feedback that we got from people is that they want to call this number and want to know that they're talking to professional, compassionate people. The biggest barrier, however, is that people just don't know what to expect when they call the helpline. A lot of people expressed, and I'm sure when I say this, you might laugh, a lot of people expressed frustration like, well, what is it like calling Comcast? And we all know if we live in the city what it's like to deal with Comcast, right? But that's what people associate when you think of hotlines, right? It's calling this customer service line where you're going to be on hold for who knows how long before you might actually get somebody who's nice to you and helpful or not. So we know that we need to do a lot more communicating and public messaging around what people can expect when they call 988 and who they'll actually be talking to. And then the last thing that we learned, again, no surprise, is just that stigma and help seeking is still very pervasive, especially for certain types of ethnic groups within the community. Reaching out for help is still really hard for people, and the stigma associated around reaching out for help is pervasive in our communities. So what we've come up with, and hopefully you've all seen this by now, is Call 988. So a really clear established brand. We're in the phase, since Line 988 launched in July, we're in this marketing phase of just building brand familiarity. So trying to get people to get used to seeing this logo that you see on the screen. We've launched a website that you also see on the screen, 988helpline.org. This is a website that we are looking to drive people to so they can get an answer to that question about what they can expect when they call the helpline, but it's also a website that's serving as a resource for our partners and stakeholders, where they can go to and download specific materials to promote the 988 resource within their community. So we've got a social media toolkit up there. We've got postcards and flyers and one-pagers that people can go to and download on their own, and then use them with their own within their own network to kind of promote this resource. We did organize a press conference with elected leaders and the helpline providers at the end of July. Hopefully some of you saw some of the press around that, just to announce that we were ready here in Central Maryland and to promote the Call 988 brand. And then the final thing that we're doing, this is work that came directly out of the Community Engagement Committee of the Council, is launching a 988 Community Ambassadors Program, which is, again, something that the Community Engagement Council recognized would be needed. The general gist of it is working with trusted community leaders across the region, people who are within community and people who are already known in community, and getting them equipped with tools and resources and messaging so that they can talk about 988 within their own local networks. So this is just getting launched, but I really like it. And I also just really love that this is an idea that came directly from community, and we're looking to support that and help to stand it up. So very quickly, just want to show some helpline data. I'll just preface this by saying we're only going to show you Baltimore City data right now, because that's what we have access to. We do have access to the data from the other jurisdictions, and once we started looking at it, we realized that we weren't comparing the same things, so we didn't want to show you all this data from different communities that wasn't the same and make it confusing. So what you're going to see now is just data for Baltimore City. I will say, though, once we do have that care traffic control technology up and running, we will have access to this data on a regional basis, things like call volume and the source for where the calls are coming from. So we are getting there. We are close to having better data, and within a couple months. So next time, hopefully next time we have a conversation with you about what's 988 call volume data, we can show you that on a regional basis. But for now, we're looking at Baltimore City. So what you see on the screen is just the call volume data for Baltimore City's Here to Help, or Baltimore City's 988 helpline from January 2019 through July 2022. I do want to point out that there was a little dip that you'll see. I think that was around March or April. That is because the contract, BCRI, who is the operator for Baltimore City's 24/7 helpline, they served as a national backup for Lifeline, and their contract ended. It was not anything related to bad or performance or anything. It's just all of this is related to changes that are happening nationally with 988. But that's kind of to our benefit, right? We saw our call volume go down because we're not serving as a national backup, and it makes us more prepared to handle the 988 transition, which happened in July. We are seeing a very gradual uptick in call volume just in the city, and we expect, as more people become aware of 988, that that's just going to continue to grow and grow and grow, and certainly that's our hope too. The other thing I wanted to share with you is just Baltimore City's call source. You'll see we get a majority of the calls are people call it self, like to fall in that self category. They're calling for themselves. So that's really informative. And we also see that we have a range of other types of community partners that also use the helpline, anywhere from our hospitals, emergency rooms to law enforcement. And finally, just want to really quickly share with you some of the community feedback we've heard about 988. So it's only, keep in mind, it's only been just about a little shy of 2 months since 988 launched, and that number switched in July. Some of what we know is that the routing of calls so the one thing that we know is routing of calls are still based upon area code. This is something that's expected to change nationally. It is a national effort. The changing of the routing of calls will eventually change to be routed by geolocation. Because people are routed by their area code, if somebody, for example, is in Baltimore City, but they're calling from a California number, they'll get routed to a call center in California. That's not particularly helpful for somebody, right, if they're in Baltimore City. So the geolocation of the routing is something that's expected to change. We don't know when that will change. And I know the state also doesn't know. That is work that happens at the national level. But we have been getting feedback from community that some callers with out-of-state area codes are not getting routed to the Maryland call center. It's not a big thing, so let me put that in context. It's not a big thing, but it is something we are aware of, and it is something that we are sharing with the state Behavioral Health Administration and partnering with them on, so they also are aware of just how prevalent that might be within the community. The other thing is just misinformation about 988. In particular on social media, and the general misconception is that 988 frequently sends police, which is actually not the case. The data does not the national data does not back that up at all. Police are sent out less than 1% of the time for calls that come into 988. However, there is this misconception that if you call 988, you may have police respond to you, or you may be involuntarily committed. I've even seen some of that kind of chatter on social media. So we are working with our communications firm and kind of keeping track of the conversations that's happening on the internet. And then the final thing is just answer times are not always consistent yet. Sometimes there are long waits. This is, again, something that we have heard from community at a very small scale. We at BHSB have been in touch with our call center operators so that they know they've already made some tweaks around this so that call times, people are not stuck there waiting. So we are trying and working actively and proactively to take this community feedback that we get and troubleshoot it to the best of our ability. So with that's all I've got for a presentation on where we are with 988. I'm happy to take any questions, Andrea, or if you just wanted to move to discussion, I can move us there as well.
So two things. I think one of the things that Ben placed in the chat, and he said one of the continued questions that, you know, continues to surface is how 988 will interface with existing 911 behavioral health diversion, MCTs and other local resources. So you know, I'd love for us to start the conversation there. And then there are just a couple of other things that I noticed in the chat and that I wanted to be able to raise. So, again, that's what Ben shared, and love to be able to have some dialogue around that, because I think that that's important, right? So it's funny because I think one of the things that we had often talked about is, you know, what are the most effective ways to begin to gather feedback about 988, call services from other. Oh, okay, there you go. So one of the things that we thought we be great for us to have some conversation around is what actions are needed to support change management across the crisis and services system to successfully transition to regionalized call center services. And so, again, love to have some dialogue about that as we, you know, as we think this thing through, and as we have just received the information that Adrian has shared. Anybody wanna weigh in? I know it's not dessert, but it's still important. Am I missing any hands? Charles, it looks like you want to say something.
Right, I'm curious about supporting change management. I mean, what you mean by that? In other words, I mean, the thing that's striking me is how important it's going to be for us to begin to have really great experiences, because that word will spread, I think. But what did you mean by change management?
Adrian, did you want to answer?
So I think it's multifaceted when you think about the change management. We are regionalizing call center services and crisis services across Central Maryland, and that is requiring change management. There is the culture change that we're trying to support through all of this, but also through 988 in promoting it as an effective resource and a trusted resource. So I think it's a lot of things. It's the system change, right? And changing the way that we're reporting data and then ultimately using that data to make decisions and hold ourselves accountable to the people we're serving. So I think it's a lot of things that are happening that relate to change management. I don't know if others want to weigh in with their thoughts too. Andrea, you're muted.
And I was talking up a storm. One of the things that Sharon said in the chat is Virginia has a well-developed plan for call centers and triage that includes 911, mobile response, etc. And so BHA obviously will be working with Virginia in this area. So I'm glad she raised that, this whole notion around the triage that includes other important entities. Any other thoughts? Oh, 2 people raised their hands. If only I could see who you were. So Katie with the dessert. Yes, Katie.
Thank you. I wanted to, I will leave it to the folks who are deeply involved in the operations of how all the services talk to each other to address change management, but a couple of things that have come up at meetings that we've been a part of. One is folks want to know that they're going to get a good service effectively. So for instance, if I'm in a community program and we have a really good relationship with Officer Jim, like we know Officer Jim, he comes around, there's a lot of trust with him. Am I going to call 988 if I'm in crisis, or am I just going to call over and ask if Officer Jim can come over? Because that's the person that I already know. And so as we're building trust, I think part of it is having those conversations across programs and services of kind of making the change of like, we're going to still call 988 because we need to, you know, who knows what other solutions may be available, versus getting some feedback about programs that would say we actually have a really good local service and we don't want to be routed through a regional system or a national system. I think there's something really legitimate there about trusting relationships, because a lot of what we hear is concerns about, is my number going to be traced? Are the police going to be sent to my home? And if you're dealing in a situation where somebody is not safe in their home or has some complication going on, maybe they have a outstanding warrant, where that it just complicates their safety to have an emergency intervention. So there's a lot of, I think, realistic kind of fears or just a lack of understanding about that piece. And the second is sometimes, as we all know, when you call a number, they'll give you a list of places to maybe go, but half of them are closed or you can't get an appointment, or they used to do that, but they don't anymore. So I think the other thing is looking at, how are we making sure that our community connections are really strong and up to date? So that, because that's another piece of this is, are you giving me bad information? Not because you're trying to, but just because you're working off of an outdated list. And then the third thing that I'll say is making sure that most calls through 988 are resolved on the phone, right? It's a lot of times it's people just need to feel heard, to talk through something, to have a safe space to express themselves and get some support. And so what about folks who are in institutions, meaning like already in a hospital unit or are in a detention center, or are in a crisis stabilization program, but in that moment, would rather talk to someone sort of anonymously on a hotline or on a warm line because they don't feel like they're getting the support that they really need in that moment. So I think that's another piece of sort of institutional change management. Like for all of the hospital partners in GBRICS, are all the folks currently residing on any hospital unit who may be dealing with, behavioral health crises, do they all know about 988 and can they make that call from the hospital bed? So those are just a couple thoughts, maybe, to get some juices flowing.
So Kitty, thank you for that. It's funny that you raised that. And I know if anybody else has their hand up, please, I promise I'm not ignoring you. I just don't see it. But would love, Oleg, if you could just sort of weigh in about how Care First sees a 988. Would love to hear some feedback. And again, just because I think you will probably know.
Sure. So we see it as a vital resource. It's no more, no less. And we've done everything we can to let 3.5 million Care First members in the DMV region know about it. We've updated all of our website and written documentations. All of our mailings that go out have 988 instead of 911. All of our care management services have been updated with 988 information. And we have recently partnered with local NBC, which is WBAL, on a campaign actually during the month of September to promote 988 through the Peace of Mind campaign that some of you may have seen on TV. So overall, the strategy is get the information out there and be ready to answer questions.
Perfect. Sounds good. Anybody else? Thank you so much. Anybody else want to weigh in? Oh, 2 other people raised their hands. Did I miss you? Where are you? Why can't I see
Looks
you?
like Robin and Tara.
Okay.
That's what I see. If I can.
Okay, great. I can't see them, but Robin, you want to go and then Tara after? Please.
Oh, Robin took her hand down.
Yeah, sorry, I had it up from before. I apologize.
Oh, okay.
No, hi, this is Tara Hargadon, Assistant Secretary from the Maryland Department of Health. I think a lot of what Kathy Rubbert Franklin from BHA and I are going to discuss this evening could probably talk about a lot of these various topics, 911 diversion, as well as some of the overall crisis system work that we're doing and how all of that intertwines with 988 as well as the ERs. So I'm excited to present to that. I didn't want to divulge too much into the conversation when we're about to talk about it again here in a few minutes. I just wanted to put that out there.
Wonderful. Thank you so much. So I think a couple other things.
Oh, Andre, I think Jill has a question.
Oh, Jill.
Or
I'm
has a
sorry,
comment.
Jill. Question, comment, either one. My apologies. Thank you, Nikki.
Thanks, Nikki. I think what we're seeing, and this may bleed into the next conversation as well, but so in the hospital, what we're seeing is the folks who have accessed mental health services in the past actually do know what 988 is and have absolutely no trust of it yet. Because they're wary, many for good reason. And then what we're finding outside of folks who have a history with interacting with mental health services, just if you ask just a random primary care patient, they have no idea what it is. So I think we've got two things going on. I think one is we still have work to do with the general awareness campaign, which we know, and then I think just for the folks who are kind of more close to the services having been provided in the past, I think some of the we come back to the same conversations that everyone on this phone is familiar with in terms of just stigma and getting people comfortable making that phone call. I've heard a lot of, well, who answers and how do I know who they are and my privacy and those sort of kind of age-old concerns that I think is just going to take time for us to get through.
That's really helpful.
Yeah, thank you, Jill. That was helpful. So I think
I work at Centro Sol. I'm sorry I was not able to log in with the link, so I had to call in and I cannot raise my hand. Can I ask a question?
Sure. And then once you're done, we'll go ahead and move right into the statewide 988 implementation. So go ahead, please.
Oh, thank you. I appreciate it. I was just trying to follow the conversation about the challenges to access 988. I'm going to echo Jill. There are some things that are already existing. Stigma is not a mystery for us, but I think there needs to be some type of trust building so that when people call, they know they're going to receive the service the way that we are promising they're going to get the service. And then for me, my major concern is the access to language services. So I have been I have been referring a lot of people to 988, and they come to me saying that when they call, nobody answers in Spanish. I work primarily with Spanish speakers and Latino populations in Baltimore City. And I will be curious to see, and I know someone mentioned earlier about data and that you're trying to gather and analyze the data that you're collecting, but how, if there are any approaches that you're planning to use to make sure that you know how many non-English speakers callers you have, and also that you have the resources in place so that when non-English speakers, uninsured individuals are making a call, because there is interest in 988, but if, again, people call and they don't get the service, that creates a lot of mistrust. So just wanted to make, I don't know if it's a common question for the leads to consider.
Andrea, that's a great question, and also something we've heard. Shauna could probably very quickly answer some of that question, if you want.
Shauna.
Yeah. Hi, everybody. I have two answers to that question. First, there is a national backup center for Spanish speakers. So if people are pressing 2 for Spanish and they're not getting through, if you could, are you in touch with Samira Abdul Fattah on our staff? If not, maybe she can put her info in the chat. If you could let her know when that happens so that we can follow up. We're just collecting information when things aren't going as planned. And then the other thing that I'll say about that is that I know that the call centers that are going to be operating the new call center have in their contract to recruit Spanish-speaking agents so that we can be one of the agencies that answer when people press 2 in Spanish, so that it'll go to a local area. So we're coming up with a recruitment plan, and I believe I know at least BCRI is working with Central Seoul on recruiting people to answer. So that's something that we are definitely aware of and we are working on.
Thank you, Shauna. Thank you.
Thank you.
Okay, sounds good. Okay, and I think we can go ahead and move into, the discussion around the statewide 988 implementation and opportunities for long-term alignment. And Nikki, you want to help us out here? Thank you.
Thanks. We're going to have a presentation from our partners at the state. We invited the Maryland Department of Health to join us today to give us a presentation on the state's vision for 988 because GBRICS obviously wants to align with the state's vision. I think we have gone about this work from the beginning, hoping that this regional model that we have here could eventually be something that's statewide. So it's very important that GBRICS align with the state. It's the only way it's going to work, and it's the only way it's going to be sustainable. And so Maryland Department of Health has been a great partner. I know BHSB is sort of in consistent and close contact with them. And so with that, I'm going to turn it over to Tara and Kathy, who are going to give us a presentation. Thanks for being here.
Oh, thanks so much, Nikki, and thanks, Adrian, for setting this up. I'm happy to be here. I'm Kathy Reber-Franklin, and I'm the Director of Service Access and Practice Innovation within the Behavioral Health Administration. And as you already heard from Tara, she is the Assistant Secretary within the Maryland Department of Health, and she will be jumping in at a slide later in the presentation, but I'm going to get us started. So next slide. We wanted to talk briefly about several specific areas. These are the priorities that we have in Maryland. It's the strategic 988 planning. This is built around some of the core values that were in the grant from Vibrant that supports 988 actions at the local level. We want to talk about 988 integration with Maryland Crisis Services because, as has been referenced in this conversation, it's one of the 3 pillars for crisis services. You can't have the stool be effective if you don't have an effective entry point. We want to talk about our data use and strategy and our public awareness plans. And all of this is designed to set the stage and the framework for the state and to help us work better and more in alignment with any of our local partners. Next slide. So just to briefly talk about this because of some of the conversation today. As you know, when you call, a call is routed. It is routed based on area code, which is incorrect, but we're hoping that the feds will find a way around that. But the two things that I wanted to mention is that if you press 1, then you receive specific assistance for veterans. And that's really key because it's really hard, just like if you press 2 for Spanish speaking, it's really hard to set up strong resources at a local level and to make those available 24/7 constantly when it is smaller populations of individuals. And so I think doing this at the federal level, although there are some limitations with it, I think it makes a lot of sense. And so we're grateful that those resources exist. So it's press 1 if you're a veteran and press 2 if you're Spanish speaking. However, I do want to say that we have been giving out funding to the locals, and part of our funding was to request that where possible, Spanish-speaking call specialists be recruited and hired by the call center just to make our services more local. Next slide. So just a little bit of background. These are the 8 Maryland Lifeline call centers that exist at this time. They're color-coded, although it can be a little distracting to see all of that. But I did want to point out some of the numbers that we have. So for the most current complete year, August of 2021 through July of 2022, there were almost 38,000 calls that came into 988. And this is when 211 Press 1 was still live. So it's interesting that there are this many calls coming in. And this is the connection between Vibrant at the federal level and the call centers at the local level. Maryland only became involved recently with 988. And so all of this activity was happening. All these calls were happening without Maryland or GBRICS or any of these other structures that have now been put into place, without any of those in existence. But through these calls, we're really trying to make sure that things are handled consistently and with the kind of quality that we expect, and to make sure that calls are pushed to the next appropriate level of care and that appropriate interventions are taken rather than 911. And so that's part of what we're doing here. You can see the chats are up and texts are up. This is, we think, it's too early to tell, but we're hopeful that this is our youth population. You know, people often say, well, you know, how do you access this kind of service for youth? How do you make it youth incentive? And the way that you do that is by having chat and text available. And so that is available 24/7 in Maryland with the 3 call centers that have the star next to their name. So we're really pleased that we can offer that. Next slide. Next, thank you. So now I want to talk a little bit about our strategic planning. Next slide. There are 8 goals that we really are looking at here. These are our core values that we have and our main emphasis that we're looking at in the implementation of 988. These are from our strategic plan that we submitted to SAMHSA to guide our work. And these envelop all of the areas that we've talked, that I heard you talking about today and more. And these will be expanded as we need to. So the core areas are that all of the states have both primary and backup coverage 24/7. There are many states that have very little coverage. There are some states that already have some coverage. Maryland has been extremely fortunate that we had a strong 988 system in the state. And so we have been building off of what already exists. Core area number 2 is no surprise. It's about securing funding to support all of this. And I'm going to get into a funding diagram soon that will show you what kind of work we're doing around that. But historically, little funding has been available to the call centers. As I said, the connection has been directly from Vibrant to these call centers without the state, which means that there was no state involvement, equaling no state resources to support these call centers. There was very little funding to support the call centers. It's shocking that they have been able to stay afloat, quite frankly, with all the work that they've been doing. And so now that we are involved, one of the benefits is we are looking for funding to support all of the work that they are doing and that we expect to increase. Number 3 is that calls are expected to be answered by Maryland call centers 80% of the time. That's the current rate and that's the current expectation. However, we do look to increase this number to 90%. So when a call is delayed in being answered by a Maryland call center, it gets bumped to a national number. And that's where we take the hit. And that's what we don't want, because we don't want our calls being answered somewhere outside of Maryland. So number 4 is ensuring that our call centers are accredited and provide consistent services, data, and quality improvement activities. And I'll speak a little bit more about that in a bit. For area number 5, it required us to form a coalition, and BHSB GBRICS was a part of that coalition. We had a wide range of stakeholders who worked on the plan to make sure that we were ready for the go live date. For number 6, we already have an established and updated resource database. We continue to work on strengthening that. There are limitations to any kind of database, but we are trying to make that stronger so that it reflects current resources and all of the resources that we want to have in there. So complete and current and consistent. Core area number 7 is follow-up with callers. We'd already been doing some of this. It's called the Raskin Act, for any of those who might be familiar with that. It's funding that we put into call centers for an opt-in process from callers who may want follow-up calls. And we would ask them if they want follow-up calls, and if so, then they would be getting follow-up calls based on a protocol. That is something that we want to expand to do more of, especially to anyone who is at high risk, so that we can make sure that we're following up with them. That work has been happening. I don't want to act like it's not been happening at all. It has been. Call centers have been doing that. However, it's been inconsistent and underfunded. And so we want to elevate the conversation around making sure that we follow up with individuals who are at risk when they call. Next area is public awareness, and this is around making sure that people are aware of the number, and we will get into a little bit of that. We also, I think Adrian mentioned this, it's really important not to overpromise what can happen when someone calls 988. And so we want to make sure that we're clear on what 988 does do, so that people don't think it doesn't do something else and doesn't do more from them than what we can actually do. Okay, next slide. So this is our strategic plan that we put together by timeline. What we wanted to identify is what happened in June and July. Those activities are successfully completed. We have been working on 911, as was mentioned in this meeting. Part of our grant responsibility is to talk with the locals to find out where they are with diversion from 911. And this is a critical point for us. We do have some of that diversion information that I'll be talking about in a moment. We have been submitting reports as required. There was behavioral health disparity impact statement that we had to send in, quarterly improvement plan. One of the big deliverables that we have in here is that in September, we're going to be starting an evaluation and continuous quality improvement meeting. This is a meeting that will be examining the call data that we're getting from Vibrant and that we're collecting with the intent of improving our performance, obviously, with the most glaring being moving from that 80% to that 90% target that I just mentioned. So beyond that, though, what kind of performance information will we be able to glean from this data? And how can we help with standardizing practices, making sure practices are consistent, and that ultimately we're providing a quality call experience to those who call in? So we have some target dates in here with some target deliverables. What is not in here is our local efforts. So with GBRICS, we have regular meetings with GBRICS. We appreciate that partnership. And there are pieces of actions that are being taken to support GBRICS. They're not in here specifically, but they are not forgotten. So I didn't want you to think that we don't address those just because it's not specifically mentioned in here. These are sort of our big global pieces that, that we're focusing on. Next slide. So here's our funding plan that has been circulated before. As you can see, we started off in FY22 with close to $1 million. In FY23, we have been able to find funding totaling over $7 million, which rises to over $8 million in FY24. And then we start to trail off. So this has been a process for us in trying to find funding. So I mentioned that some funding came down from the federal government. The governor allocated $5 million for this fiscal year. There's $5.5 million available next fiscal year through the legislation. And there is funding available, additional funding available from SAMHSA. We are using our ARPA funds, and we are continuing to look at other funding. For instance, we put in funding for SOAR 3. That was a grant that we just submitted to SAMHSA. It's effective the end of this month. We haven't heard back yet from SAMHSA as to whether they've approved our submission, but in that submission is funding to support 988. And so we're really hopeful. We've received preliminary nods of approval, the nonverbal approval, but we are really hopeful that they will come through for us and allowing us to use the funds for that purpose. Next slide. And next slide. So this is where I wanted to mention that we are integrating services because, as you know, you need some place to call, you need someone to talk to as number one, you need someone to respond, not 911 as number two, and then you need somewhere to go. So 988 is not a standalone entity, although it does have its own unique and specific issues associated with it. There are specific actions that we're taking related to 988. It is part of a bigger picture, and it has to be. And this bigger picture has to include 988. So we are looking at not just the Maryland Crisis System Work Group, which is active, and that BHSB is a part of that system, of that work group that we're looking at. We're looking at how we link together all of the crisis services so that we can envelop someone with all the services that they need, all the care that they need in order to prevent or mitigate a crisis that they're having. So again, we want to move away from the idea that we're calling 911 and move to the idea that we're calling 988 with the intent that 988 will then be able to deploy, if necessary, resources. I did want you to know that about 80% of calls are handled by the call taker themselves. Those call specialists are very good at managing calls. Many people who are calling are already in services. They don't need new services. They need someone to talk to at 3 a.m. when PTSD is getting the better of them and they can't get the images out of their head. So that's the kind of work that our call specialists are doing that don't necessarily mean that anyone has to be deployed. But deployment is necessary, and we are building up those resources throughout the state so that there can be an active response to everyone who calls in if they need it. And then there are some other coordination projects that we're working on. Hospital discharge planners are now able to call 211 and press 4 so that they can receive assistance with getting individuals out of an ED who need outpatient services. Individuals get stuck in an emergency department for all sorts of reasons, and placement can be one of them. And so we are, as a first step, looking at individuals who are stuck in emergency departments because they need outpatient services but can't get them. We are, as a pilot, expanding this to hospitals that have inpatient psych units, and those psych units who need placement for those individuals need to discharge patients from their unit but are struggling with outpatient placements are also calling them this 211 press 4 as part of our effort to make sure that our resources are as available as possible. We have BHA care coordinators who are involved with this effort to assist 211 with trying to find appropriate placements for individuals in a very timely way. And included in this effort is an electronic portal and data collection and follow-up to find out what happened to the individual. Did they get to where they needed to go? Next slide. So this is the 911 effort that I mentioned. We surveyed our locals to find out, that the PSAPs, to find out what kind of diversion protocols they have in place. And as you can see here, it's a mix. What is unfortunate is that there are 12 jurisdictions that don't have any protocols at all. And then other jurisdictions are anywhere from planning it to actually having a fully operational diversion protocol. Baltimore City has a really robust diversion protocol. We met with them, and it is quite impressive. I know that there's additional work to be done. Some BHA funds were awarded to BHSB to continue the work on fine-tuning their PSAP response. So we're pleased that that is happening. And we think that Baltimore City and a few other jurisdictions really have models for the other jurisdictions to look at in terms of how to divert individuals from 911. In order to make this a success, we have to get our 911 operators trained. There have to be really clear protocols. There has to be the support needed for them. There have to be behavioral health specialists available to them. There has to be movement of these calls from the 911 call center to our 988 call center. And that's what this work is doing. Next slide. So we're moving towards phasing out of our Maryland 211 Press One that we have had in place for several plus years now. We are keeping it live because it's out there. The number is out there. So we can't discontinue the number. We need to keep it live. However, we have really moved away from looking at 911 Press One as our crisis resource, and instead 988 as our crisis resource. And you're going to be seeing our promotional materials that push us in the direction of 988. 211, as I previously mentioned, is still around. We still use them. They're doing callbacks through the Raskin Act that I mentioned. So this is callbacks to individuals who opt in to receive a callback. So they are assisting us with providing that service. They are assisting us with the hospital, emergency department, individuals. And we are using our dollars that had previously gone to 911 for public awareness. We're using them and pushing out 988 material. Next slide. So I'm going to turn it over to Tara for her to discuss the next slides.
Thank you, Kathy, and good evening, everyone. Nice to see everybody. I see lots of familiar faces and names, so good to see everyone. Just wanted to kind of walk you guys through a little bit of our stakeholder engagement and also our data use strategy and partnerships that we put into place here in the state. In July and August of this year, we partnered with DMI, which is a Maryland-based technology company that is going to work with us and continues to work with the Maryland 988 Lifeline centers across the state to gather and aggregate data that is going to help us drive informed decisions in the path forward to really be able to better coordinate crisis services, to ensure that we see where the volume of calls is going across the state, but also make informed decisions on our path and strategy forward for overall planning, as the years to come. A lot of that information will be collected and we will have them to meet our federal reporting requirements that the federal government is keeping us to, and will help us provide a lot of oversight and operational implementation path forward. That data is going to be a huge set, and also allowing us to apply that to our marketing and public relations strategies moving forward. If you don't mind clicking on that next slide for me. A lot of our marketing materials will be focused in specific areas and where we're seeing a lot of that traffic. So the next few slides, we're just going to roll through some of the toolkit things that we have put together. If you just mind staying right here for a second. We published a toolkit in July of this year, in which you'll see a few of those marketing materials and screenshots in the next few slides. We really wanted to stay close to the branding that SAMHSA has implemented to ensure that you see this familiarity from our constituents. We want to make sure that they're seeing the same color schemes, that they're seeing that 988 branding, but also seeing that the Maryland Department of Health is partnered in there so that they see the familiarity at the state and federal level. So we have been working very closely with lots and lots of organizations across the state to send out our toolkit and really asking our partners, and some of you on this call have likely received this as well, to really help us, make that brand recognition and allow our constituents to know what resources they have at bay. So over the past couple of months, we have been showcased in some newsletters coming out of the state, but also some of our partners. We've done a heavy push into our faith-based community to ensure that the 1,500 plus organizations across the state are also putting this information either in their brick and mortars, but also through their e-newsletters and flyers. We have lots of either handheld postcards, posters. If any of you have come to and fro from the beach over the past couple of weeks, you may have seen our 988 billboard coming out of Ocean City. There's also a few more that we'll show you here in the next couple of slides. But here's just a very quick overview and snapshot of some of the organizations that have partnered with us to really help send out and spread the great word of 988 and what we have to offer our constituents. So if you don't mind clicking the next slide, please. So our toolkit is right here on the website, and we'll provide all of this information to you guys as well. The toolkit, again, provides wallet-sized cards, digital ads, our audio spots that you may hear on some of your streaming services, as well as local radio stations. And then there's flyer information on what to expect when calling 988, and then also posters that we're also working with MSDE to get these into schools as well. Next slide, please. So when you do go to the website at 988.maryland.gov, you will see all the information that you do need that will also be stated on those toolkit materials. So information for our constituents, providers, you name it, coming to the website and understanding really what we have out there, and also our community partners, but really talking about the various resources that 988 offers. And then at the bottom of that page, we also link to all of our SAMHSA resources as well. Next slide, please. So these are just some screenshots of some of our wallets and posters. Again, you'll see a lot of that branding that is very familiar from the federal level, but also with our state branding. Next slide, please. And we do have everything is also going to be both in our English and Spanish. We have print materials in Spanish too that we've taken out into the community, and also at some local conferences. Next slide, please. And here is our billboards in the wild. You will see some. There's one on the 95 corridor, one on Route 70, one on Route 50 coming westbound from Ocean City. And there, I believe there's one more, and I am drawing a blank, but I will find that to provide that information to you guys as well. And then one last slide, which is going to showcase our digital ads that you'll find on social media. We also have put these into our toolkit so that any of our partners across the state can actually just capture and use that on their own social media platforms to push out the resources that we're providing through 988 as well. That concludes, I know, our hefty presentation. I know it was a lot of materials, but I know just hearing and listening to the first half of this call, I heard a lot of questions that were regarding around some of the information that we discussed here this evening. So Kathy and I are both welcoming any questions, comments, or anything that we can do to answer any additional questions.
There was one comment in the chat. Besides using the area codes to distribute calls, how are the call centers making sure that the calls are distributed equally to all in the current cohort?
So that actually comes directly from Vibrant. Kathy, did you want to answer that?
Yeah, we don't do the call distribution. The call distribution is from Vibrant, and it's based on, as much as they can, it's based on area code. Some of our call centers do get more calls than others, and our funding is allocated proportionately. So the chats and text call centers, those three that I identified, they get funding just for chats and texts. The rest of the call centers are being funded based upon the number of calls, their call volume that they've been handling this past year.
Thank you. Any other questions for our friends at Maryland Department of Health? A lot of great information.
Good, glad to hear it.
Thank you for having us. And I'm going to drop my email in the chat just in case anybody wants to reach out to either Kathy or I. Will put our emails in there.
Thanks.
Hi, Monica again from Centro Sol. Sorry, I was not able to log in with the link. So is it possible to email me your email somewhere? Yeah, I can spell out my email address.
Absolutely. If you don't mind emailing maybe Adrian, and Adrian, could you connect us via email and we can share this information?
Yep, happy to.
Great. Thank you so much.
Thank you.
Other questions? We were hoping to have time to facilitate a discussion on how we can better or ensure alignment between GBRICS and, you know, the state's actions on 988. But considering that it's 6:27, why don't maybe we will start our next meeting in November with those discussion questions, and, you know, encourage all of you to sort of think about it, where we are with GBRICS and what we've heard from the state and how can we create that alignment. Unless anybody has any specific thoughts they want to pipe in with right now. Okay. And if I'd love for the GBRICS council members, you know, we are at the 6:30, almost at the 6:30 mark. We had planned on having 10 minutes for an executive session, but since it's 6:30, would love to know people's thoughts. Do we want to stay on for 10 minutes and have that session? Or we will start that with the November session. It's raining, it's dark. I understand if nobody wants to stay on. Any strong thoughts from any of the council members? No? Okay. Well, let's a reminder that that we will be meeting hopefully in person, fingers crossed, in November. I think we're still looking for a location. But November 14th at 5 is our next meeting, and it will be so
Actually,
great.
it's
Yeah.
wrong. I had the wrong date. So sorry, I had the wrong date in the memo.
Of
and the
December
agenda.
15th, December 12th at 5.
Yeah, sorry about
Yeah.
that. It
Sorry.
did, but it does say like, yeah,
Yep.
it's actually in December.
So it'd be great to see everybody in person. It'll be close to the holidays, and we'll have a chance to all finally meet in person and celebrate the great work that we've been doing together.
We will all bring dessert.
That's right. Good call. Okay, great. With that, I guess we will conclude unless anybody feels strongly that we stay on for an executive session. I'm happy to stay. Okay. Thanks, everyone. See you in December.
Thank
Take care.
you.
Have a good night.
You.
Bye-bye.
Thank you.